the task to talk about heart disease, particularly in diabetics, and what all diabetics need to know in order to ensure that they keep good health. So without ado, I'm just gonna give you a little bit of statistics. I'm sure being this is a diabetic group chat, this is probably well known. Diabetes is extremely common and prevalent. A lot of the patients that I see who've got diabetes are undiagnosed. About 30 to 50% of patients are undiagnosed diabetes and are found to be diabetic after they come in with one of the complications. So globally is a massive problem. The trouble with diabetic condition is that it increases the risk of developing cardiovascular disease. And in simple terms, diabetics, with time, tend to develop an increased risk of pump failure, pump problems, which is affecting the heart, filter problems, which is affecting the kidneys, and pipe problems, which is affecting the vasculature. So heart failure is a very big concern because it affects probably more than 50% of the patients with diabetes. A lot of it is subclinical symptoms, but only found out later. And the other issue with cardiovascular is obviously risk of developing strokes, because the complications of diabetes causing high blood pressure, hypertension, and also furring up with the arteries. Atherosclerosis, as we call in medical terms, is you get peripheral vascular disease where the circulation is restricted, and then leading to amputations and obviously infection with gangrene. It is unfortunately quite common in patients with uncontrolled and long-standing diabetes. I'm particularly going to talk about concentrating on the type 2 diabetes, non-insulin dependent diabetics. I think that is the majority of the patients with diabetes tends to be suffering from this population. Now, 2/3 of diabetics eventually will, the death of 2/3 of patients with diabetic tends to be cardiovascular problem. And the most common recognizable one, as I've mentioned before, is heart failure. And we do really need to prevent this by looking at and controlling the potential risk factors. And I'm sure you're all aware, risk factor for diabetes is no different from anybody with non-diabetic, including hypertension, high blood pressure, smoking, lack of exercise, being overweight, and all these will contribute to an increased risk in a diabetic group, more so than in a non-diabetic group. Now, how do we recognize it? How can we screen for it? And I think the most important thing is recognizing that, first, you're going to make the diagnosis of diabetes, and no different from non-diabetic, you're still going to screen for cardiovascular problems, the risk factor I've mentioned. And you need measurements of blood pressure. You've got a measurement of kidney function, and that could be due to using urine dipsticks to make sure you haven't got proteinuria, so secretion of protein, because the filtering system of the kidneys is not functioning so well. Measuring the cholesterol level, making sure that your lipid profile is what we call favorable, so that reduces the chance to get more of the good cholesterol rather than the bad cholesterol. And recognizing symptoms of breathlessness, which is common in patients with diabetic, who a lot of them can be overweight, who could be a lack of exercise, and tend to think that the breathlessness is due to just being not fit, not recognizing that it is due to initially silent heart failure, and then subsequently will develop more severe version of the heart failure, which is the heart's inability to pump the blood around properly. Now, how do we recognize that the heart is at fault? Simple terms is obviously assessing with heart trace, ECGs, looking for rhythm problems, which can commonly occur in patients with diabetes. Atrial fibrillation is more common in patients with diabetics, with diabetes, and looking for the strength of the contraction of the heart using a blood test called a BNP, and a blood is a brain natriuretic peptide. This is just a simple blood test, and that will tell you whether the heart's under strain or not. And if this is abnormal, if the blood test is abnormal, then you go on to do a scan of the heart, which is an ultrasound scan called an echocardiogram, to look at the heart. And that will then visually see the strength of the heart. You'll be able to look at the size of the heart, looking at the heart valves, and see whether there's any issue regarding that. Now, heart failure, what causes heart failure in patients with diabetes? It's a combination of factors, just like I mentioned, the presence of high blood pressure, the presence of high cholesterol, which then causes what we call coronary artery disease. That's furring up of the fuel pipes of the heart. And that tends to then restrict the blood flow to the heart. And then that will then has a tendency to lead to the risk of developing angina symptoms. Angina symptom is pain in the chest or discomfort in the chest due to the heart muscle being starved of its blood supply. And also, obviously, with coronary artery disease, the risk of heart attacks. Thing that we worry and fear the most is sudden occlusion and blockage of the blood supply to the heart, so that the muscle then dies or starved of its blood supply. And that's one of my specialties, is to open up these arteries in order to restore the blood flow to the heart. Now, there are many investigations you can do in order to assess for these conditions. And once you've made the diagnosis that there is evidence of high blood pressure or high cholesterol or presence of heart failure, or somebody who's had a heart attack, of which 30% of the patients that I see with heart attack tends to be diabetics. And after initial treatment, then they need long-standing treatment, in order to prevent the condition from deteriorating and progression. So drugs is the mainstay for treating these conditions. So you need to lower the cholesterol. Statin therapy is most effective. You've got to be on aspirin, which reduces the stickiness of the blood and therefore reduces blood clot. You need to be on other blood thinning medicine in order to prevent strokes. And you need also to be on a drug called ACE inhibitors, sometimes which the one called Ramipril is most common. Beta blockers, well, like bisoprolol is common. And these are medicine to prevent deterioration in the heart function and also to strengthen the heart in the long run. These are the common medicine that we use for patients with cardiovascular disease. And it doesn't matter whether it's stroke or whether you've got furred up arteries in your legs or whether you've got furred up arteries in your heart. The treatment's the same for all of them. And that's the reason why medicine is used, because it treats everywhere in the body, not just in the heart. The management after, there are the new treatment that's has been introduced now to the mainstay of treatment of patients with heart failure, particularly in diabetics. There is a class of drug called SGLT2, and they're gliflozin type medicine. There's canagliflozin, there's dapagliflozin, and again these have change in the way that we manage patients with diabetes, because it's that treating diabetes is not just about lowering the blood sugar. It's about prevention of cardiovascular complications, cardiovascular morbidity and mortality. And a lot of the diabetic drugs that we used in the past lowers blood sugar, but it doesn't actually prevent you getting the subsequent complications. The current diabetic drugs have proven in large trials that it can reduce your risk of death reduce the risk of heart attack, reduce the risk of progression of cardiovascular disease, including strokes, and even deterioration in the filter, the pump, the kidneys. So there's reduced deterioration of the kidney function over time when they're on these particular drugs, which I think is very important that all diabetics should have an opportunity to be on in order to prevent long-term complications, which clearly is a burden to the NHS, and also it's a quality of life issue affecting the patient itself. Now, we've got to recognize that in patients with diabetes, they do worse than patients with no diabetes in all aspects of the potential complications. So the need to increase the uptake of these medicines in order to prevent these conditions is vitally important, and not only just for the individual, but also for the NHS spending, in a sense, because these are preventative medicine, which would then prevent and reduce the chance of heart attacks, strokes, which causes a huge burden for everybody. This topic is huge, as you know, and it's difficult to go into all aspects of it, but my prime take-home message for you is that you've got to look for the cardiovascular condition in patients. If you suffer from diabetes, you've got to look for those conditions rather than wait until something happens and then get it diagnosed, because early treatment have a beneficial effect. A bit like in a sense, like a pension plan. If you invest early, you get a bigger pension pot at the end. If you start early, you're going to be able to prevent in the longer run. You'll be better off, and you can't really wait until somebody presents with a heart attack or with a stroke and then start the prevention therapy.